and for the White House has been equity, ensuring that all Ohioans, no matter where they live, can get vaccinated if they choose to do so. This is part of why the Wolstein Center was chosen for the clinic. We thought about this. We talked to a lot of different people and made the decision it needed to be in Northeast Ohio, and then came to the conclusion that really the Wolstein Center on Cleveland State campus was the best place to do it. Cuyahoga County alone is home to more than 1.2 million people. Within 6 miles of this site alone, there are more than 100 neighborhoods with higher than average social vulnerability. With the help of more than 300 local community partners who are going into neighborhoods, giving citizens information about the vaccines, and helping them register. And I'm just going to name a few of them, but there are, as I said, over 300 local partners. They include the Urban League of Greater Cleveland, the NAACP, the Greater Cleveland COVID-19 Rapid Response Fund, Global Cleveland, the Hispanic Roundtable, faith-based groups, and many, many, many more. This is really an example of Ohioans coming together to make a difference. Fran and I have had the opportunity to travel all over the state in the last 10 days. And what we have seen in community after community is volunteers coming together, Ohioans in the individual county rallying together. And as we've looked at the different sites, frankly, we've seen every type of site. We've seen the National Guard into high-rise senior citizens, housing. We've seen fairgrounds used for drive-through in Marysville, for example, but the common denominator every single place is people coming together, Ohioans coming together to really, really make a difference. We had the opportunity just a moment ago to talk to some of the translators. We have translators here for, I think, 6 different languages on site to accommodate those who speak different languages so that every Ohioan vaccinated here has the best experience possible if people have questions. Our partners are offering free transportation to and from the Wolstein Center for those who need that transportation. We've also are working on plans to bring vaccinations directly into the neighborhoods, and we'll have more about that in the next few weeks, more announcements about that. Besides this site, there's another 150 sites in Cuyahoga County alone where people can get the vaccination. Right now, those who are age 50 and older, plus those with certain medical conditions, can sign up for an appointment here in Cleveland or at any of Ohio's 1,300 vaccine providers throughout the state. So that's the number we are up to statewide. As I said again, 150 of those locations right here in Cuyahoga County. So very, very exciting. Let me talk for a moment about where we are. Today we will, when the data comes out today, it will show over 2.4 million Ohioans have received their first dose. 1/5, better than 1/5 now of all Ohioans. That's not adults Ohioans, that's all Ohioans. Over 1/5 of Ohioans have received their first dose. And very happily, we are now crossed over 2/3 of those 70 years of age and older, and that number we hope will continue, but that is our most vulnerable population, so 2/3 of those now have been vaccinated with at least their first dose. As I said, Fran and I have been really traveling around the state, and it is an amazing thing to see all the volunteers who are coming together, to see what the local health departments are doing, and all the other partners in every single community. So I want to publicly thank all the volunteers, not just here, not just the people who are working the Wolstein Center, but people from throughout the state of Ohio who really are making a difference. Now, before we get to the other speakers, I want to talk for a moment about where we are going from here in Ohio. The question that I get asked, of course, every day is, when will my group be able to open up? When will I be able to get a vaccination? So Fran and I spent the weekend talking to different health departments, actually visiting where sites were taking place. Also this morning, I had the opportunity, as I do once a week, to talk to all 113 health departments in the state on a conference call and try to ascertain exactly where we are as far as the vaccinations. My question to them this morning was, are you filling up? How fast are you filling up? Or have you had to cancel any clinics? Just exactly where you are. And the answer that we got back was certainly mixed. In some parts of the state, there is more demand, frankly, geographically than in other parts of the state. But the consensus from talking to the health departments, who really have their best view of what is going on, the consensus at least was that we need to open up vaccinations even further. We've always had two goals. One main goal. The main goal is to save lives, and we do that in several ways. One is by focusing on the most vulnerable, and that's why we started in our nursing homes. That's why we started with people 80 and above, and we've continued to add medically fragile groups and move forward on that. So we've tried to target what we are doing, and that, I think, has worked very, very well. But at the same time, there is an imperative that shots not sit anyplace, that we get them taken up as quickly as possible. Fran and I have a friend, and I shared this with some of you before, but Fran and I have a friend. I talked to him one day. He was getting his shot. The next day, his first shot. The next thing I heard, a few weeks later, he had died. So he did not get the shot early enough. If he'd got it a week before, or 2 weeks before, maybe that would have blocked him from getting the COVID. So there's just an imperative that we move as quickly as we can. This vaccine is still, this virus is still very, very, very much out there. Fran and I were walking this morning through the Cleveland Clinic, and the red is still up, and indicating exactly where we are as a state. So a moral imperative to get this out just as quickly as we could. Let me talk about supply. We are running this week about 400,000 coming into the state of Ohio. That is very significant. That's gone up, as you know, continues to go up. Next week, we don't know the exact number. We'll be given that exact number later today, but we think it's going to be in the neighborhood of 400,000 doses. The week of March 29th, we've had every indication from the federal government, from the Biden administration, that we will see a rather significant increase for the week of March 29th. So this is all background as far as what I'm going to announce. So today, we're going to extend eligibility. The extension of this eligibility will start on Friday morning, this coming Friday morning. So I'm announcing that this Friday we will open eligibility to individuals who have one of 5 specialized medical conditions that may increase their risk of severe illness and death from COVID. This is in addition to the other medical conditions that we have already announced. This offers protection to these high-risk individuals who are not already eligible through our age-based approach to vaccines. Eligible individuals can receive a vaccine from the provider, of course, of their choice. We are calling this 1E. This is what we're calling 1E. This includes individuals with at least one of the following medical conditions. They are as follows: cancer, chronic kidney disease, chronic obstructive pulmonary disease, COPD, heart disease, and obesity. So again, those are cancer, chronic kidney disease, chronic obstructive pulmonary disease, heart disease, and obesity. This group, we estimate, is approximately 766,000 Ohioans who would not be otherwise eligible by age or other qualifying condition. These are individuals who would be under the age of 40, which brings me to the next phase. Second, what we're calling Phase 2C will also begin on Friday, March 19th. Phase 2C will extend eligibility to all Ohioans who are 40 years of age and older. 40 years of age and older. This eligibility is about 818,000 Ohioans between the age of 40 and 49. So if you look at those two, again, eligibility for Ohioans 40 and above, 40 to 49, that adds 818,000. If you look at the 5 chronic disease conditions that we've listed today, of those are individuals who are under the age of 40, and that is 766,000 Ohioans who are added. So between these two eligibility groups, it's about 1.6 million new Ohioans who will now be eligible. So that everyone can plan, we are also announcing today that beginning on March 29th, every Ohioan will be eligible. That's all Ohioans age 16 years of age and older. So again, I'm announcing that on March 29th, eligibility will open up in Ohio for every Ohioan who is 16 years of age and older. It's important to note that teenagers who are 16, 17, 18 will only be eligible to get the Pfizer, 16 and 17 will only be able to get the Pfizer vaccine. The FDA emergency use authorization for the Moderna and Johnson & Johnson vaccines only covers individuals aged 18 and older. So just one little caveat there. I want to thank everyone who's made today possible, and I want to talk for a moment about what's going on just in Cuyahoga County and in the surrounding area.